Thank you to Kumar Prabhasar and Vijay Patil sir for giving this opportunity. Uh, Now today we have discussed all advances in lung cancer from molecular this immunotherapy, target therapy. Now we'll again come back to our basic. So we already know that lung cancer is one of the most commonest cancer all over the world, and in lung cancer the chronic morbidities are cough, breathlessness, fatigue, and if you come to the cough, the prevalence varies from 40 to 70% in various observational studies, and out of these, more than two-thirds patients are having severe troublesome cough during their course of the disease. So cough not only having this giving you physical, but it also affects your psychological, social, and lead to even social isolation also. But till now there is no any effective treatment for cough. So this was a very unmet need in the lung cancer. So this study was conducted based on the background that Aprepitant was already approved drug for nausea vomiting, which blocks the substance P activation of neurokinin 1 receptor, and this was also one of the mechanisms implicated in the cough, mainly in the central region. The substance P activation of neurokinin 1 receptor lead to this initiation of cough through the vagal neural C fibers, which was located in small airways of the lungs. And other than these these C-type fibers, there are other mechanisms also, the inflammatory cells in the airway, lymphocytes and macrophages. And in the central system, if you come, there is a nucleus tractus solitarius, where again there is a secretion of this substance P, and which leads to the activation of this neurokinin 1 pathway. And so from peripheral to central, there is the involvement of this neurokinin pathway, and based on this background they evaluated the role of NK inhibitor like Aprepitant in cough to control the symptom in lung cancer patients. Previously also this were attempted, but due to poor central action of the earlier molecule and the endpoint was not well defined, so it led to failure in controlling the cough. But now with the better availability of the Aprepitant, which is having a central action, they conducted this study. So this study was basically a randomized double-blind controlled trial and crossover trial in patients with lung cancer, and it was conducted at the Christie National Health Services Foundation Trust in Manchester, United Kingdom. So the main aim of this study was to assess the efficacy of the Aprepitant to control the cough, and another is to evaluate the mechanism of this cough and how it suppresses the cough by assessing the vagal nerve tissue. And when we come to the primary endpoint, the first was to see the so over a period of time they found out some endpoints, and they included these endpoints to make the primary endpoint in this study. So one was the awake objective cough frequency, and another primary endpoint was the during sleep frequency and 24 hours frequency. This was the primary endpoint, and they kept the secondary endpoint as the patient's reported outcomes. And there were few validated scales, which includes a cough severity visual analog scale, Manchester cough in lung cancer scale, and for few also they have utilized AO-RCTC, but not for all patients. So basically there were three scales which were included in this secondary endpoint, which were reported by patient, and they included adult patients who were diagnosed with non-small cell lung cancer and had a bothersome cough for more than 4 weeks, and had a performance status of 0 to 2, and was willing to participate in the study, and had a few exclusion criteria also. And in that exclusion mainly was the patient who were having on treatment with drugs which may interact, or having some infection on antibiotic, which may again interact with your results. So this was the basic study design of this trial, where they randomized patient in crossover design like study. So they initially randomized patients either on Aprepitant or placebo. Then after a washout period, again they cross over the patient and The vice versa, the respective group took either a placebo or aprepitant. So at baseline, they assessed the scores for 24 hours, and after randomization and taking treatment, again on day 3 they observed the patient for 24 hours, and again did all the scoring of the scale. And after 3-day washout period, again for day 7 to day 8 and 9, they given treatment, and from day 9 again they did the scoring, and final follow-up scoring they did at the day 13 and day 14. So this was the consult diagram. They included 20 patients as per their statistical method, and out of this only one patient was excluded because of he developed the respiratory tract infection, and remaining 19 patients completed the study. So when we come to the results, we see that the main primary 3 endpoints, awake cough frequency, sleep cough frequency, and 24-hour cough frequency. Out of these, the awake cough frequency and 24-hour cough frequency has shown a significant response to the aprepitant, including a significant P point. Only the sleep cough frequency was not significant, and it was due to large variation in the symptoms. And when we come to the other patient reported outcomes, again we can see the visual analog scale, MCLSCS scale, and EOTC all has shown a significant response, statistically significant response to the aprepitant. So these were the graphs. If you see for awake cough frequency and 24-hour cough frequency, you can see how the lines were going down with the aprepitant, and you can see the p value is also very significant. Only the non-significant value was during sleep, and you can see the way how was the variation. And last part was included in this study was the mechanism. So they took the guinea pig vagal nerve, and they given the substance P, and they shown, you can see how with the substance P there was a stimulation of the nerve, but when they treated that nerve with the substance this aprepitant, there was a complete blockage of the depolarization. So it also shown that it was acting on the nerves. And when we come to the adverse event, you can see there is hardly any adverse event, and it was none patient have developed any grade 3 or grade 4 side effects. So in conclusion, it was a positive study to show that in refractory cough, this aprepitant is one of the options. The limitation of this study was it was a very small study, and the follow-up was very small, hardly 2 weeks. So these were the two more main limitations, and obviously it was a proof of concept study. So sample size was very small. Thank you.